Hello, my name is Haley Bianchi, and today I'm going to be doing my final head-to-toe physical assessment video. This is Jessica. She's my patient, and she has consented to the video. I'm going to go ahead and begin. Hi, Jessica. How are you doing today?
I'm good. How are you?
I'm very good. So you appear in no acute distress. Your skin looks normal in color of your ethnicity. I don't see any lesions, and you appear to be warm, dry, and intact skin. So I'm going to go ahead and move to your scalp. It is normocephalic, atraumatic. I don't feel any lesions. Your face overall looks symmetric. The hairline looks intact, no hair loss. Next, I'm going to be assessing your sinuses. Let me know if you feel any discomfort, any tenderness.
No.
No, I don't know any swelling. Next, I'm going to be assessing your lymph nodes. This is the periauricular. This is the posterior auricular. This is your occipital. I'm moving to your tonsillar, your submandibular, the submental. Then we're going to move along here to the posterior cervical and anterior cervical, none of which are palpable. Next, while I'm here, I'm going to check your trachea. Can you go ahead and lift? Trachea is midline. Can you go ahead and swallow? That is intact. Swallowing, which is cranial nerve 10. Have you had any difficulty swallowing?
No.
No, okay. I'm going to be assessing your TMJ. So go ahead and open and close your mouth. Very good. I don't hear or feel any clicking. This is also cranial nerve 5. Your jaw is moving normally. Face is moving normally. Open and close your eyes for me. And smile with your teeth. Your teeth also look beautiful. Your gums look great. So cranial nerve 7 is also intact. Symmetrical face movement, eye movement, mouth movement. Sensation-wise is also part of cranial nerve 5. Do you feel this?
Yes.
Okay, so all of your cranial nerves are intact. Your face is symmetrical. Let's move back down to your neck here. I'm going to check for any jugular venous distension, which none is noted on the left or the right side, which is very good. Go ahead and look straight for me. I'm going to auscultate your carotid, and then we'll move to palpating it. No bruit is noted on either side. I'm going to go ahead and palpate your carotid. That is +2. Very good. Go ahead and shrug your shoulders for me. Very good. That's cranial nerve 11, and you actually have very good strength there. I want to feel for your mandibular bone, which it is intact. I don't feel any cracks. They're in the right place. That's very good. I'm going to go ahead and palpate your thyroid now. So it doesn't appear or feel to be enlarged, and it is moving normally. Is there any discomfort?
No.
Okay, awesome. Okay. So I think we've completed that assessment. I'm going to move to your cardinal gazes, which is cranial nerve 3, 4, and 6. So I'm going to have you do is follow my finger, okay? Without moving your head.
Okay.
Okay, those 3 cranial nerves are intact. I'm going to be moving to your eye assessment, which includes cranial nerve 2. But first I'm just going to check the sclera and the conjunctiva, which your eyes, the color looks normal, no jaundice is noticed. White in color, sclera is pinkish red, and it's moist. I'm going to go ahead and grab my light here. So I'm just going to first check the cranial nerve 2, which is part of your pupils, making sure they're reactive to light, accommodating equally, which that is there. Very good. Now I'm going to be looking into I'm going to be checking the red reflex, looking at your retina as well as your optic disc, making sure it's not blurry, and the vessels surrounding, and the macula, all in both eyes. red reflex is noted and your optic disc is not blurry. It is nice and distinguished. I'm gonna go ahead and look at this one. If I can get the light. Right, red reflex is noted. Vessels, macula, optic disc, all very much intact. No blurriness noted. Have you had any difficulties with vision at all?
No.
Okay. Awesome. We're now going to be moving to your nasal passage. Have to change this here. Have you had any congestion?
No.
Okay. So in here, there's the mucosa of your nasal passage is good. The turbinates are normal. I don't see any swelling, redness, nothing that is not normal. I'm going to be moving to your mouth now. So go ahead and open your mouth for me and say ah. Okay, so uvula is intact and it's moving normally. That is cranial nerve 9. Now the mucosa is pink, normal. Let's go and see your tonsils. Go ahead and say ah again. Very good. They're grade 1. I don't see any lesions. Everything is nice and moist. The buccal and the mucosa is all normal. Your tongue is normal. I don't see any lesions. Your teeth, smile for me again. Your gums are good. Stick your tongue out for me. Okay, now I'm checking cranial nerve 12. Can you move it to the left and right? And up and down. Okay, that cranial nerve is intact. I'm now going to be moving to your ears. So upon external ear inspection, it looks normal. I don't see any lesions, no protrusions. Let's go ahead and look at your tympanic membrane. Make sure that it's intact. It is a pearly gray, and I see no particles, no obstruction of any kind in that ear. We're looking at the same thing. Here's normal, a couple piercings, but nothing out of the ordinary here. Your tympanic membrane is intact, nice pearly gray. Have you had any difficulty hearing?
No.
No, well, I'm gonna go ahead and assess that, okay? So I'm gonna be using my instrument here to assess bone to air conduction hearing. But before I do that, I'm gonna do the whisper test, which checks cranial nerve 8. So I'm gonna have you cover one ear and I'm gonna whisper into the other and you let me know what I'm whispering to you, okay?
3, 4, 5.
Okay, very good. Over here.
1, 2, 3.
Very good. So you passed that. Cranial nerve 8 is intact. I'm gonna be doing the Riney test. That is the bone to air conduction. So you let me know when you stop hearing the bone, and then you tell me which one's louder, the bone or the air, okay?
Okay. Okay.
So which was louder?
Air.
Okay, very good. The same on this side.
Okay. The air.
Okay, very good. So you passed that test as well. So we completed the hearing test. Now we're gonna be moving on to your thorax. So we're gonna start posteriorly. So if you can turn around for me. Okay, so I'm gonna be checking for CVA tenderness. Now let me know if you feel any tenderness in this area.
No.
No, okay, that's very good. It would show, if you did, maybe sign of infection in your kidneys. We're gonna be doing tactile fremitus assessment. So actually, I'm gonna have you move a little to the right for me. Okay, so with tactile fremitus, I'm gonna be placing my hands on your back and you say the words 99 for me, okay?
Okay. 99. 99. 99. 99. 99.
Very good. Now I'm gonna be percussing. So actually let me auscultate first and then I'll percuss, okay?
Okay.
So you just breathe normally. Actually, don't breathe normally. Take deep breaths every time I place my stethoscope on your back, okay?
Okay.
And now I actually want you to say 99 for me as well, okay?
Okay.
Every time I place my bell down, or my diaphragm.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, that's my bronchophony exam. Now I'm gonna be percussing. Okay, so the posterior exam is complete. So let's go ahead and turn around and we'll do the anterior exam. Okay, so the same thing here. I'm going to be doing the tactile frontis in the front, okay? One. Okay, go ahead.
99, 99, 99, 99.
Okay, very good. Now I'm going to be listening to your lung fields in the front, and then I'll be listening to your heart.
Okay.
Take a deep breath every time I place my stethoscope. So all lung fields posteriorly and anteriorly are all clear. I don't hear any diminished lung sounds.
Okay.
Nothing has been a negative at this point. I'm going to be moving to your heart sounds, okay? So you could breathe normally on this. I'll be listening to them with both the diaphragm and the bell, okay? All right, so this is your aortic valve. This is the pulmonic. This is Erb's point. This is the tricuspid. This is the mitral. I'm going to be flipping over to the bell. Right, and same here, aortic. The pulmonic. Erb's point. Tricuspid, and mitral, which is also the point of maximal impulse. And I'll have you lean forward so I can hear optimally. Okay, very good. I didn't hear any murmurs, no extra heart sounds. It was a normal assessment cardiac-wise. I'm now going to be moving to your vascular assessment. So I'm going to be assessing your pulses, okay? Which this keeps blocking. So I'm going to be assessing your brachial. Very good, +2. Your radial. Very good. Let's go ahead and check your skin turgor while I'm here. All right, you don't appear dehydrated. No clubbing of the fingernails. Cap refill is less than 3 seconds. Warm in temperature. Let's go ahead and assess the lower extremities. So this is your posterior tibials and your dorsalis pedis. They're all +2. Your skin is normal in color. It's warm, good circulation. We're gonna go ahead and assess your tendon reflexes, okay? So I'm gonna get my mechanism here. Go ahead and turn a little bit. Okay, so I'm gonna assess in both arms the bicep, okay, the tricep. Very good. Here, bicep, tricep. Very good. Let's do the patellar, which they can see here. Very good. Very good. Your reflexes are all intact. We're gonna move to your range of motion. So I wanna make sure that you have good range of motion in your upper and lower extremities and that you have good strength. So first, I'm gonna have you just move your arms up and move them down and move them around, making sure I don't hear any clicks. You have no pain or discomfort, so stick your hands out and start rolling your wrists for me. And then move your hands in and out. Put your hands up and down. Awesome, beautiful. Now we're gonna check to see if you have any signs of carpal tunnel. Can you go ahead and put your wrist like this? Go ahead and show the camera here. Now this, if you were to start feeling any numbness or tingling, it would show a sign of carpal tunnel. Do you feel any of those symptoms?
No.
No, okay, perfect, that's great. I want you to squeeze my hands really hard. Okay, now push me away, pull me. All right, now lift up. All right, now pull down. Okay, very good. That strength is great. We're gonna do the same with your legs. I want you to just move your legs out and kind of just move them around. I wanna make sure range of motion. Can you lift one leg? Good, lift the other leg. Move your ankles around for me. Very good, no pain or discomfort.
No.
Looks like you have great range of motion. I want you to lift your feet up for me, like strength-wise. Now push down like a gas pedal. Okay, now lift up your legs. Okay, good, very good. Push down. Okay, very good. So the strength appears great. Your range of motion is good. I'm gonna have you stand up for me. So I'm gonna first just assess your balance. So go ahead and just look here and close your eyes for me. This is the Romberg's test. I don't see any swaying. I don't see any signs of imbalance. Now open your eyes for me and try and stand on one leg and the other leg. So your balance is normal. I'm just gonna have you walk that way for me. I'm gonna assess your gait. Just walk that way. Her gait appears normal. Go ahead and walk back for me. Very good. You don't feel any dizziness, lightheadedness, nothing. Okay. Let's check for signs of scoliosis. I'm gonna have you bend over. Her range of motion is also very good. She's able to touch her toes. Her spine is in line. No curvature noted. Go ahead and stand up normally and kind of bend backwards to see your, okay, range of motion is spectacular. So you have passed that. I'm gonna go ahead and assess your abdomen. So I'm gonna have you lay down while I move the camera here. Okay. So overall, I'm gonna take a seat here. Overall inspection of your abdomen your abdomen looks normal. I don't see any protrusions, no signs of hernia, doesn't look asymmetrical. The only thing I note is the scar we previously spoke about from a surgery, but otherwise normal in appearance. I'm gonna go ahead and auscultate. Just gonna listen to all 4 quadrants, making sure your bowel sounds are normal, active. Very good. So all bowel sounds are normal, active. I'm gonna go ahead and start just lightly palpating your abdomen. And let me know if you feel any discomfort just on the light. Any discomfort there?
No.
Okay, awesome. Now I'm gonna deeply palpate. I don't feel anything abnormal. I cannot palpate your spleen, which is good because that would show a sign of splenomegaly. Even though you are small, I do palpate your liver, which is normal. Now I'm going to do my percussion, okay? And typically the percussion is tympanic until I reach an organ, which the liver is, over the liver is dull, which is normal. But otherwise, everywhere is tympanic. I'm gonna do the assessment to check for appendicitis. So I'm gonna deeply palpate the left lower quadrant, and if you feel any pain radiating to your right lower quadrant would be a positive sign. Do you feel any pain at all?
No pain at all.
Okay, so no signs of appendicitis. And then I'm just gonna palpate your aorta, which is nice and strong. Do you have any questions for me?
No.
No? Okay. So this concludes my head to toe physical assessment. Thank you for watching.